The broadcast is now starting. All attendees are in listen-only mode.
Hi everybody, this is Sam. Welcome to the second webinar. I want to just give a few details before Louis introduces Clara Hill. We're going to use a couple of polls during the webinar. One will be for direction, so figuring out what direction you guys want the webinar to go in. And then another will be at the end. We'll be asking you sort of how useful you found it and how applicable to your research the presentation was. If you have questions during the presentation, please use the question panel on the GoToWebinar control panel to ask your questions. I will be monitoring those, and as they come up, I'll turn them over to the moderator, Louis, who will then propose those questions to Dr. Hill. And if you have clarifying questions during the presentation, Dr. Hill has asked that you please write those in because she'd be happy to clarify while she's presenting. So with that, I'll turn it over to Louis.
Thank you, Sam. It's a great honor, pleasure to welcome everybody to this second SPR webinar. Sam tells me that we have more than 30 people now who are attending. It's so great to have such engagement. As all of you know, this initiative really was aimed at fostering the engagement of early career researcher and scholar in the field and trying to best answer and address their needs. And this would not have been possible. I want to take just a few seconds to thank Sam, but also Kim and Sven for all of their work for many months to make this possible. Of course, I also want to thank Clara for accepting to our invitations to present during this second webinar. As all of you know, Clara really is a luminary in the field. She has published tremendously. She also has been recognized by SPR. She is a former president of both NASPR and SPR, and she also, despite the fact that she's very, very young, has won the Distinguished Career Award a few years ago. Clara is also, in my view, the person who's been the most dedicated to different aspect of the structure of SPR and to the student development. So it's quite apropos that she is one of the person who has been voted from the early career scholar to actually presenting in this webinar. Clara has worked in many areas of psychotherapy and psychotherapy research, such as process, looking at a therapist intervention, for example, clients' involvement, such as the insight. She's also contributing quite substantially to the field in terms of training and, of course, her work on DREAM. But she has also devoted a lot of energy and work in issues about methodology of research, both process and outcome. And today, as you know, she will be addressing one aspect of her work regarding methodology that is a specific method that she has developed to do rigorous qualitative research. So thank you, Clara, for accepting to give us a webinar, and I'm just basically going to ask you now to start your talk.
Thank you, Louis. It's a pleasure to be here, and thank you so much, Louis, for setting all this up, and thank you, Sam and Sven and Kim. This is such an exciting opportunity to talk about my research. It's a little weird talking into a computer with nobody in front of me since I'm so used to looking at cues, but let's get started. I got interested in doing qualitative research about 20 years ago. A lot of people were talking about qualitative research, and it was kind of hard to figure out how to do it because most of the methods out there were very vague, and it didn't give much of an idea about how to actually do the research. And so I set out with Barbara Thompson, and Renee Rhodes and Robert Elliott helped us try to figure out how we could create a systematic way of doing qualitative research that was relatively structured and yet was still open to a lot of feedback and a lot of innovation. Just to give you some ideas for how qualitative research can be used, these are just some of the studies we've done that I've been involved in. We've looked at impasses in therapy, therapist self-disclosure, sexual attraction to clients, countertransference, internal representations, gift-giving, supervisor's feedback, becoming psychotherapist, dreams, compassion. These are among many of the topics, but I just wanted to give you a feel of some of the richness of some of the things that can be covered talking about qualitative research. Many of these are difficult things to study from a quantitative perspective simply because we don't have measures to look at these things, and even when you have measures, what you get on a thing of, like, let's say gift giving, you might say, oh, 20% of the clients gave gifts to therapists, but it doesn't tell you much about the phenomena. So from looking through qualitative research, we can get much more an idea of what's going on or what people are feeling or what their inner experiences are. So to start with, what I'd like to just tell you about is some of the features of consensual qualitative research, which I refer to as CQR. As I just mentioned, you can investigate clinically rich, infrequently occurring inner experiences, things that are hard to investigate, things that perhaps haven't been investigated before. These are things that are particularly useful to study through qualitative methodology. This method provides data that's descriptive, and the method is inductive. In other words, we're open to what the data reveals. We go in with research questions rather than hypotheses. We try to let the results emerge from what the data tells us. This is particularly important when we don't know what questions to ask or we don't have measures. We use words to describe phenomena. People are storytelling creatures, so we're using words to ask people to tell us about this. It's hard to know, again, on a measure what a number means, but we can use words to try to understand. Because we try to examine cases in great depth, we usually only examine a few cases, but we really try to use the whole context of the entire case to understand parts of the cases or why people are responding as they do. One of the things I particularly like about CQR is that judges can use their clinical wisdom. When I was doing process research before CQR, and I still do some of this kind of research, but one of the main features is we would develop a category system, for example, to look at therapist verbal response modes. Then we would train judges up, and they had to put each therapist's verbal response into one of 12 categories. In other words, we had to force agreement between judges. And what judges would tend to do is they would think about, well, what would the other judges say? Or what are the clues? What are the tricks that I can use to put it in a category? But in point of fact, all these therapist behaviors in this context, many of them are gray. They're not clear-cut. And so we end up forcing agreement. We end up forcing people not to use their clinical judgment. And we end up telling them to put things in little boxes. Whereas with CQR, what we can do is we don't force agreement. We try to enhance the clinical wisdom of the judges. In fact, we try to get as much perspective as we can. We typically have a primary team of at least 3 judges, best if they're of equal perceived power. And we also include at least 2 auditors or people who are outside the team who can, again, provide different feedback. So we're trying to get as much feedback as possible. We're not aiming at the truth because this is kind of coming from a constructivist philosophy where we don't assume there's a truth, but we're trying to get the best construction that we can, given our limitations within any given research team, the best construction we can of the evidence. Okay, a big feature of CQR is we use consensus then. In other words, we have as many perspectives as possible, and we argue through to consensus. We try to maximize as many perspectives, and then we try to continually think about, well, what does this thing mean? How can we summarize this? In many ways, CQR is similar to what clinicians do. So when we're looking at a case, for example, in CQR, we often talk about it in the same way that you would talk about a case conference. But importantly, we constantly cycle back to the data repeatedly. So whenever we're making a decision, we go back to the data and say, well, what does this say? What does this person mean? What is the context? Okay, so we're constantly cycling back. For many of you who may be familiar with other qualitative methods, this method is a little more rigorous than some other methods. In other words, many other qualitative methods maybe only use one judge, maybe change the interview protocol throughout, but we try to have a relatively structured way, but also maintain rigor as we're going.
Muted.
This is one of the main points where we can use your feedback. What we would like to do is I can go over traditional kind of CQR and talk about how you do interviews, how do you do domains, core ideas, audits, and cross-analyses. I'm happy to do that. I can also spend time talking about innovations that we've developed recently to CQR, such as qualitative meta-analysis, CQR for case studies, or CQR modified for simple data. So if you all would just answer the poll right now, we can decide if you want to talk about, again, more an overview of CQR traditionally methods, or if you want to jump right to one of the innovations in CQR. So I'll just give you a moment to vote.
Clara, it looks like the most voted for one is describe each of the steps of CQR in greater detail.
Okay, let's do it. Okay, are we back on? Okay, we're going to describe the steps of traditional CQR the way it's typically been done using interviews in more detail. So let's start out by talking about interviews. Okay, so the main way we get data, and most of the studies that have been done so far using CQR have used interviews. And typically, we first develop an interview protocol. And what that means is we develop our questions for the protocol from the literature, from our own experiences, from focus groups. We try to develop as complete an interview as possible from this means. Typically, an interview protocol consists of an opening grand tour question to build rapport. This typically is a relevant question, but maybe less evocative than some other questions later. Things like, how do you feel about therapy? What's your relationship with your therapist? Those are kind of broad questions that kind of set the stage for later the participant getting into more depth. In the main section, we explore the topic in greater depth, and I'm going to show you an example in a minute. But these are the main questions we use. And then we have a closing section where we reflect on broader implications or what the experience was like participating in the interview. The interview consists of open-ended questions, and by open-ended questions I mean questions that don't have a single answer. If I say, how old are you, that's a closed question. If I say, how do you feel about your therapy experience, that's an open-ended question. So we typically in an interview have a series of 8 to 10 scripted open-ended questions per hour interview. We ask only one open-ended question at a time, because if you ask a series of 3 or 4 questions, people will only answer one. But we want to ask the same questions of all participants so we get consistency across participants. But we call this a semi-structured interview because we also want to probe for individuals. Even though we spend a lot of time developing the protocol, we often don't know what might come up that we're not used to. So we want to have plenty of room to probe for individuals, and sometimes we go off on tangents, and that's great because we often learn things we hadn't expected, and that's the joy of qualitative research. But we also then always come back to the scripted interviews so that we have consistent data across participants. One of the things we've toyed with is how many interviews to have, and typically we're thinking now it's good to have at least 2 interviews per participant. A lot of these things that I'm going to tell you depends on the study. So I'm going to say it's good to have at least 2 interviews, but that depends. Once we get an interview protocol developed, we want to consult with experts in the field, people that know a lot about this phenomena, to make sure we've captured the phenomena as completely as possible. We pilot, we revise. One of the things you'll notice that I'll say throughout this whole presentation is we pilot, we revise, we revise, revise. This method is one that encourages constant tinkering to try to get it right. So we want to make this protocol as good as we can before we start out, because one of the problems that typically comes up when you get kind of bad data is that the protocol wasn't good or it wasn't administered well. We often give the protocol to participants in advance because it helps them know a little bit more about what they're getting into. And sometimes, like if we're asking therapists, for example, about their feelings about different kinds of clients, they really often need to go back to their case notes and kind of review their case notes. So it can be very helpful to give the protocol in advance. Okay, so go to conducting the interview. It's important that you select interviewers who are very empathic. In many ways, an interview is like a therapy session, but it's like you stick to the open-ended questions. You don't interpret, you don't go beyond that, but you really are trying to listen and trying to hear what the person is saying at a great depth. You're trying to hear what they maybe aren't quite saying, and you want to encourage them to say more. So in many ways, it's really helping people explore their concern about this one particular focused issue in great depth. Really important to train interviewers because you want some consistency across interviewers. So practice, 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 give feedback. We often practice in a group. We do 2 pilot interviews, make sure that they're really doing it well, are very familiar with the feedback, know when to probe, know when to go on. In terms of the relationship with the participant, it's very important to have a research alliance with the participant. People only begin to open up if they feel rapport, trust, and safety, just as in therapy. If you don't have rapport, trust, and safety, people aren't going to participate and they aren't going to talk to you and tell you the kinds of things, the deep issues that we tend to want. Again, here, though, you have to balance support with the need to acquire information, because we are, after acquiring information, we're not doing a therapy session. We're trying to get information. So there's the balance of support and getting information. Of course, you record the interview because you can't rely on notes, because we all know how inaccurate those are. You transcribe the interview verbatim. So here's an example of an interview. This is for a study we just finished on termination. So we're starting with a grand tour question. Tell me about your relationship with your therapist. We listen, we probe, we get as much out of them as we can for this one question. Then we go on to the next question. Tell me about your goals for this particular therapy. Then what is the sense of the progress you made toward those goals? And now we're ready to start on the meat of the interview, where we say, now I'd like to talk to you about your termination with this particular therapist. How did the termination occur? Pause. Wait for them to respond. Typically, people will say all the things that we have indicated here about probes. If they don't, then we may say, well, when did that occur? Who initiated it? How far in advance? Tell me more about that. One of the big probes we continually use is tell me more. Anything else about that? Tell me more. We also, by the way, restate, because any of you have used my Helping Skills book, you know that if you restate, that helps people keep going. So we want to restate a lot to help make sure that they've said what it is they want to say and said it in as much depth. So you can see how one question could take a person 10 minutes to respond to in great depth. What were your reactions to the termination? How did the termination affect you? How, if at all, did you talk about the termination with a therapist? Do you wish that, if at all, do you wish the termination had gone differently? How did this termination experience affect your feelings? Now you can see how these are open. There's not one response. People could go many, many ways with these questions. Then we typically ask for demographics, and then we like to finish the interview with, why did you choose to participate? And then how was the interview for you? Very important to find out how the interview was from an ethical perspective, if the person was stirred up a little too much, or if they need a referral, or if they need to be, kind of calmed down or closed up a little bit. Very important, again, therapy skills are very useful here to help people make sure they're okay. Okay, now I'm going to shift to talking about domains. Domains are how we take the interview and we begin to chunk it into topic areas. Topic areas are broad things that the interview has covered. And typically we develop this domain list in two ways. From the interview questions, we kind of cluster them, but we also allow domains to emerge from the interview. So we go through the interviews and we look at what people are saying, because remember, people don't, you've asked a question, but they don't always respond to that question. Sometimes they respond based on what they feel. So we're both trying to get at the domains. What are the general topics from these two ways? We make up a list, we try it out in several transcripts, and again, we keep revising until no more domains emerge. We go back to the earlier transcripts and we recode every time new domains have emerged. Let me give you an example. This is a study we're currently doing. It's kind of fun. I'm teaching an undergraduate course, teaching students how to do CQR, and this is the study they came up with wanting to do. Is attitudes about seeking help. So we're asking undergraduates who've never been in therapy about their attitudes. And so here's the domain list we came up with. Beliefs and attitudes about seeking help. The development of those beliefs and attitudes. The client's role, therapist's role, desired relationship with therapist. How do they deal with conflict? Benefits of seeking help, barriers to seeking help, feelings about diagnoses and labels, and the reactions to the interview, and then kind of an other category. And this is where things go that they may have brought up that only one or two people did. This category, this domain is very important to think of ideas for future research, for example, or maybe only one person says it, but we want to highlight that when we write it up because that's so important. So those are domains. Then what we do is as I said, we go back to the interview data. We assign chunks or blocks of data. It could be a phrase, a thought, unit, sentence, a paragraph. Sometimes it's pages of interview data that all are on that same topic that are sequential to each other. We block that off and we assign it to a domain. Sometimes we have to double and triple code, but we try to do that as little as possible. If you find yourself double and triple coding a lot, typically indicates that your domains are not unique. Then what we do once we've domained it, we put it into a consensus version. And this isn't a great example here, but usually we use a table format in like Word, and we have 5 columns. We put the case, we put the line numbers, because we always want to be able to go back to the data, remember. And then we put the raw data, 3rd column. 4th column is where we're going to put the core idea, and the 5th column is for our domain. So you can just see a format here of how we do this. So that's consensus version after domaining. So now we go on to core ideas. We construct the core ideas, and basically I mentioned sometimes people can go on for pages. They can talk for 5 or 10 minutes. We want to summarize what they've said. Sometimes they go off in tangents. Sometimes they give long examples just to kind of illustrate what they mean. We want to take what they've said and summarize it, summarize what they've said within each domain in clear and concise terms. So we're trying to, again, within the context of everything they've said, we're trying to understand what they've said and make sense of it in a way that transcends beyond that case, that can be understood across cases. We rotate who speaks first, because this is very important that everybody have an opportunity to say their view, and very often I work with students. I make sure, usually I don't speak first at all, because I want to make sure that everybody gets a chance to have their voice heard. I want to hear their ideas. I want to make sure that everybody says what they're thinking. And then we come back by consensus and decide. Sometimes we rely on getting really picky about the words. Other times it's big vision kind of stuff. But we're just trying to construct the core ideas to make sense of it. So this is the very first. This is an example of core ideas, and this is from the attitudes towards seeking help. So the interviewer says, so what comes to your mind when you think about therapy? Participant says getting help when you really need it. Sometimes when somebody sees the need, you get, I can't read that because I have the screen there. And here's a good example of the interviewer to find more need. So the interviewer is trying to get as much depth as possible. What do you mean by need? Anything. It can be mental, it can be physical, or just anything. Anything that's not your normal day-to-day. Okay, so when you say, she's restating here, you say something that doesn't usually happen in your life. Yeah. And what would you say? Tell me more about, does this need to be at a certain level when there's a need? Participant, it's hard to tell because, with physical therapy, it's like obvious, it hurts, but, and again, I can't read the whole screen, but it's mental or something else. Sometimes it takes time to notice, and they go on and on. The core idea here is people should get help when they really need it. When it's for something that's not normal for them, if they notice something about themselves or someone close to them says they need it. Now, you might come up with a slightly different core idea. This is a core idea that 7 of us actually worked on together. And we try to stay close to the words the participant is using, but we also try to make it shorter and more concise to kind of capture what they're thinking. Again, we redo the consensus version, so now I'm filling in the column on the core ideas. This doesn't reflect what I just read. I'm just giving you an idea of the format here. Okay, so now audit. So we've had a group, we've had multiple perspectives in the group, but groups can often get into groupthink. They can try to persuade each other a little too much. One person can be dominant, one person can withdraw. So it's really important to get someone outside the group to audit. Initially we started with 1 auditor. More recently we've been moving to 2 auditors because just like when you have reviews of journal articles for a journal, if you have 5 reviewers, you get 5 very different reactions usually. So 2 auditors often helps get different perspectives, and again helps you get closer to portraying the data in as complete a way as possible. Again, never close to the truth because our biases and our expectations enter in here. And I'm not going to talk about biases and expectations at this point. You can ask about that later if you're concerned. But for right now, of course, we're all biased. And so we need to just try to get as many perspectives as possible. We send the auditors the consensus version of the case with the domains and core ideas. The auditor reads everything. They almost read it as if they're there, and they try to say, this doesn't make sense, you've left something out. Maybe the domain doesn't work, the category of the domain. They're looking at both domains and the core ideas at this point. And they get really, really picky. The same person who likes to critique a journal article often likes to do this kind of auditing because you have to get really picky and you have to get involved in the interview. Then they send their feedback back to the team. The team goes over it. They sit around complaining about the auditor. And then they say, well, okay, well, let's go back, and they constantly go back to the raw data and check, well, maybe the auditor had a good point, and they have to change it. But sometimes the auditor wasn't aware of everything that was going on. They hadn't heard the interview. And so as long as you keep going back to the data, you can disagree with the auditor. When I do this for dissertations, I always serve as the auditor. And I often, because this is when I'm training people how to do CQR, I often go back and forth with the audit 3 or 4 times before the team gets it right, gets an idea of how to do the audit. This stuff sounds relatively easy until you start doing it, but lots of times it really requires doing it with somebody who's been familiar with it to make sure you learn these steps. Okay, we then move to the cross-analysis. Everything I've talked up till now has been within cases. Within cases, we've looked at the domains and core ideas, and at this point we have a consensus version for each case. But now we want to go across the cases and try to see if there's any similarities in the themes across cases. So now we create a monster file. Sarah Knox came up with this term. I loved it. Or she also calls it the beast sometimes. And we're again using our format. But now, as you'll see here, by case, we have all the cases and we've sorted it by domain. In the table function of most Word programs, you can sort by domain, which is why we use this format. We only have one idea per line, and we then have that core idea, and we have the 4 cases. And I just made this up. This isn't real data. But we can look across these now, and we look to see if there's any similarities. For these 3, we might say negative feelings toward therapist, 3 of the 4 cases. So that might be one theme we come up with. So we cluster similar core ideas. Basically, it's interesting when you're doing domains and core ideas, it gets relatively routine. You get very good at it, but it's kind of routine work after a while. When you do this part, this is incredibly creative. I liken this to before you're looking at the forest, you're looking at every little twig of a tree. But now you have to kind of come above the data and look at the forest from outside and kind of look and see, well, are there sections of the forest? Are there parts here that look this way and other parts that look a different way? So we want to kind of see what we can from the data. And this requires, again, a lot of creativity, a lot of ability to look at the data and make something out of it. So what we initially do is we just try to cluster core ideas within domains across cases to see what the common elements are. Okay? The team gets together, they argue about the categories. It's very interesting. People at this stage typically have very different categories, and we need to look and say, well, where did you come from? Where did you come from? So that's just how we get to this. It's kind of like the magical aspect here of just figuring out what you've got. Some domains are easy. We typically start with an easy domain. Some maybe only have 2 categories. Others might have 8 or 9 categories. Others might have many subcategories because you're defining each thing in exquisite detail, trying to get as descriptive as you possibly can. Here's an example of a very easy domain. This was from the sexual attraction study. This was just the emergence, not the emergency, I'm sorry there. That's an interesting slip. The emergence of sexual attraction. Some people said it emerged after therapy had gone on for a while. Other people said it was at first sight. So you can see those are 2 categories within that domain. Once we come up with a category structure, which is within each domain, we have categories and subcategories, we apply that to the data. We go back to the data in our monster table, and for each unique core idea, so now we've had to sometimes we've had core ideas that were like 10 core ideas in like a paragraph. We have to separate those or make a separate unit. Each separate idea we give a domain coding to, and each one has a separate line. So we're going to code that into one of those categories. As we start coding, you guessed it, we're going to revise again until that list gets right. And we often keep revising continually as we go through this process. And again, we send it to the auditor who makes suggestions. They often at this point say, you have too many categories and subcategories or too few. The labels aren't clear. The data doesn't fit the categories. They look at things that couldn't get coded, and they try to go back and code them. And again, the primary team goes back over all of their suggestions and revises as necessary. We then, of course, we want to know how representative are these core ideas. Do a lot of people say them or do a few? So we add up how many participants have core ideas within each category or subcategory. We only count each participant once per category or subcategory. And then we label it a general if it applies to all or all but one of the participants, typical if it applies to more than half, variant if it applies to at least 2 up to half. If it applies to just one person, we usually put that in an other domain and look at those later to see if they all can be put together in some way. So general, typical, variant is a way of describing how much these data apply to this sample. Remember, we're not generalizing to the population at this point. We're just saying how typical these are of this sample. So here we go with a cross-analysis table for the sexual attraction study. again, the emergence of the sexual attraction. Typical was it emerged after therapy began. Sexual attraction at first sight was variant. Therapist experience of the sexual attraction. Many had negative feelings. It frightened them. They were scared. That was typical. Many of them also felt a physical response. Their chest tightened, whatever. That was typical. A variant was, for a few of them, it was positive. So now we can begin to characterize, right, for this sample, okay, a lot of therapists have some pretty negative feelings and the physical feelings get involved in sexual attraction. Okay, so that gives you an idea then what we do. When we go to write this up, of course, we want to use quotes, exact quotes from the participants, because that helps illustrate to your reader what these results mean. Because again, we're telling stories. We want to say not just they had negative feelings. That doesn't communicate. When we really want to communicate, we have to give the quotes. We come up with the most evocative quotes we can that show each individual category. And then we also provide a longer illustration of all the results that are typical for that person, for that person across all the categories.
Clara, you were asking for people to voice their question as they
Right.
are coming along. Sam just informed me that we have a number of questions now coming regarding the cross-analysis.
Great. This would be a perfect time to do that.
So I think what I'd like to do is have the people who raise their hands ask the write in their question, but I think we're also going to try opening up the microphones so that they can ask them in person. So the first person I'm going to open up the microphone for is Raquel. So hang on one moment. Okay, Raquel, your mic is open.
Hello.
Hello.
First of all, thank you very much for your presentation. I'm enjoying it very, very much. I'm also using consensual cognitive research in my work, in my current work.
Great.
But I would like to understand a little bit more about the part where you said that you pick all the core ideas, the abstract of the core ideas, and you put them in the categories.
Right.
And then you go back, this is where my question is, you go back to the abstract and see if every idea belongs to that category, or you go back to the raw data of that core ideas.
Okay, at this point we're just working with core ideas. You can see in the monster table we've actually deleted the column that had the raw data.
Okay.
So we're going to the core idea. Now sometimes if the core idea is not clear, we have the line numbers there, so we go back to the raw data to make sure we got the right core idea. And sometimes we have to revise the core idea at this stage. But we're just taking, and we're taking the core ideas in simple units, because some parts of the core ideas that we had may fit in one category and not in another.
Or may fit in both or some several categories.
Right.
What we were doing, I hadn't understand this by your articles, and what we were doing already was putting all the core ideas separated, and doing we didn't put all the core ideas in the categories. We treated each core idea in a separate way. So we were already doing that. I don't know if it's correct. If
It gets yeah, that's fine, because you have because you only have one category for each for that section.
Yeah, but I think it takes more work the way we are doing it, because I don't know.
Yeah, well,
Maybe.
you know, it's I don't think that's a problem. You know, as long as you have everything in that category, that's the core ideas all fit within that category. That's fine.
Of course.
There's a lot of tedious work in this. You're right.
Yes. Okay, thank you very much.
Thank you.
So now I believe that Sophia has a question.
Sophia, I've opened up your microphone so you can ask your question out loud if you'd like to. Okay, it's possible that she may not have a microphone. In that case, Sophia, if you can write your question and send it to me, I'll make sure that it gets answered later on. But for now, Clara, why don't you pick up with the presentation? We have no further clarifying questions.
Great. I think at this point, I think I would rather go on if people would like to hear about, maybe you can do a little poll again and see if people want to hear about qualitative meta-analysis or CQRM or CQRC. Because I've kind of covered the basics of...
Clara, the second most requested category was for the person specific, so the case study.
Okay. Great. Okay, so what I've talked about so far is using CQR with interviews. And interviews are great because you can ask a person specific things that you want to ask. But a lot of times, you know, when we're doing psychotherapy research, we have tapes of cases, and we really want to understand what's going on in the session itself. And so what we tried to do is figure out how to modify CQR so that it could apply to cases. And we've done a lot of experimenting around with just kind of how to do this. And I think the thing that makes most sense at this point is the idea that you have to select a very clear topic. I remember the very first case study I did way back in, I hate to say it, 1983, I think it was. I was interested in a case study, but I was just interested in general in what happened in the case. And I had stacks and stacks of notes about the case. There's so much that goes on in psychotherapy that you cannot attend to everything and publish it in a systematic way. And so what you need to do first is select a topic, a specific thing, and develop specific research questions about that case, of what you're going to look for in the case. You need to select a team of judges, get a case, and then what you're going to look for is events within the case. At least this is the way we've done it. Again, there may be other modifications, but for example, we were interested in looking at therapist immediacy. What happens when therapists talk about the here and now relationship, when they talk about what's going on between the therapist and client? We define that as one person says something about how they feel about what's going on in the relationship. Maybe the therapist said, how do you feel about what's going on between us today? The client answers. Both people we defined had to join the conversation. So if the therapist said, how do you feel about what we're doing, and the client ignored the question, we didn't count that as an immediacy event. So within a case, the case we published in 2009, we first of all, we watched the entire case, and then we went back and said, okay, now we know what we're really interested in. We're interested in these immediacy events. We're going to code every immediacy event. So we went back and watched the session. So now this is the second time through the case. And every time we saw an immediacy event start to occur, we stopped, and then we watched the whole thing, and then we went back and watched it again. We coded what was the context before the immediacy event started occurring. And then we looked at what went on in the immediacy event. Then we also, for this particular case, we had asked the therapist and clients, kind of a triangulation kind of thing. We had asked them how they felt about immediacy in the session, so we had their comments to go on. And then we said what we thought the effects of the immediacy were. And then we came up with an overall conceptualization for each session of what we thought the effects of immediacy were. So very intensive analysis, going from watching the whole case to then going back and watching every session, and then after we watched the session, going back and watched the event completely and coding by consensus again, so we had, in this case, I think we had a large team of five judges. We went back and looked at these things, the context, post-session comments, the effects of immediacy, and the conceptualization. And by the way, we also then had the therapist, after we were done, the therapist reviewed everything and the client reviewed everything, so they could give us feedback later, so that we had both our own experiences as a team, and also we had input from the therapist and client. In this case, we didn't have auditors because we thought there was no way an auditor could be as into the case as we were, watching everything and having the opportunity to discuss it. In a sense, having the therapist and client provided the other perspectives. So then what we want to do after we've done that is we want to summarize across events. And in this case, we analyzed simply the 7 most extensive or important events within the case. And we were able, based on just this one domain I'll just describe here, we were able to look at the consequences of immediacy across these events. And we noted that the immediacy enabled the therapist and client to negotiate the relationship. It helped the client express her immediate feelings to the therapist. It helped the client open up to deeper exploration. And it provided the clients with a corrective relational experience. So you can see an example of how we did a cross-analysis across the 7 most extensive events. And then we also, by the way, compared that to another case and found consistency across 2 cases in exactly the consequences. So that gives you a little bit of an idea of the CQRC in very broad detail. I'll just stop there to open it up to see if there's questions about that.
So if you have questions, you can use the raise hand button, or you can type them into me, and then I'll open up the mic so that you can ask your questions of Dr. Hill.
So we have a question from Eva.
You did. Hi, can you hear me?
Yes, I can.
Okay, hi. First of all, I'd like to thank you because I'm in Greece actually right now. So it's very exciting that I have the chance to be able to watch this and be a part of this.
Great.
I'd like to ask about consensual qualitative analysis used in case studies. I'd like to ask if there is any chance that this could be applied to group therapy.
Sure.
So that can be done, even though it's going to be a whole lot of more data, I read.
Right.
But it can be applied to groups as well.
Absolutely. You might pick a particular events that will go on within the group. You might want to look at times when there's conflict within the group, and you might look exactly at what goes on within that conflict. Right, so it'd be just as easy to, well, groups are always more complicated, but you can do it just the same way you would do an individual case.
Okay, thank you very much.
Sure. Any other questions?
It looks like for now we don't have any more. We can open up for questions beyond just qualitative research for individual case studies, and open up for broader questions if people have other questions.
Well, why don't I do a little thing about CQRM just to give another example of something else you can do with CQR data. Sometimes, particularly for example, I'm on a dissertation meeting later, right after I leave this, and the student did a large survey study on SurveyMonkey. But then at the end, I always encourage students to ask a couple open-ended questions. So she asked a couple open-ended questions and had people write in their results. And over, my experience has been, particularly on dissertations, that students find the most exciting data from their open-ended questions. But lots of times, for example, the people are, they have more than 100 participants. Well, clearly you're not going to analyze the data in quite the same way you would use for regular CQR. So we've developed a kind of a CQRM method modified for simpler data. So first of all, we ask maybe just a couple questions, and then a sub-team develops domains, categories, and subcategories right away from the data. So in other words, you're actually doing the cross-analysis there. Most of the time when people write their responses, they're pretty short. They don't go on and on for pages. And so it's not as difficult to understand what they're meaning. So you don't have to do the core ideas. You just take exactly what they've said and place it within domains, categories, and subcategories. Once you have this domain category structure, a larger team tries to use the system and keeps modifying it. And then once they have a stable system, they code each individual idea into that system by consensus. And we don't use auditing, we just use a larger team. And just as an example, let me tell you about a study we did. We're currently in the process of writing it up, where we were training undergraduates to use immediacy. Okay, so we had 132 upper-level undergraduates. After our training, our 4 hours of training on immediacy within a helping skills class, we asked them to complete a reflection paper, and that reflection paper was a 2-page paper where they talked about what difficulties they had learning immediacy. They talked about what the most helpful components were, what the least helpful components were, and what effects their culture had on them being able to learn it. When we went to make up the domain category structure, we had 4 domains right away that reflected the 4 questions, but we also had 2 unexpected domains that came up based on people's answers, and the additional ones were what they would have liked different in training and what the outcomes of training were. So just to give you an example of what they liked most and what they liked least, after we coded them into those categories, we could look at what percentage of people went into each category. And what was really cool is what they found most helpful about the training was practice, and followed by modeling, and then instruction and feedback. What's very cool about these data, and we're excited about writing them up, is Bandura, of course, in his learning, talks about the essential components of training are typically instruction, modeling, practice, and feedback. And the previous literature, quantitative literature, had shown that it was instruction and modeling that were the most helpful. And what we were able to show from the qualitative stuff is that, in fact, practice was the most helpful. And this clearly reflected, every time I've taught helping skills, that students find practice to be enormously beneficial. Interestingly, though, many also found some elements of the practice not very helpful. So that's also important. And one of the things that they found very unhelpful was being watched, their anxiety about being watched. So again, this is just a very, very brief overview of how you can do CQR, again by consensus, because the big thing here is consensus. You're developing categories, but you're not making people use reliability. So instead of forcing people to put each response in a particular case and judging reliability, we rely more on the team's judgment of having 3 or 4 people sit around together, read each thing, and make sure we're picking up on everything the person has said. So this is the real intense part here, is that we really want to get as much from each participant as we can. So again, let me stop there and see if there's any questions about CQRM.
So again, if you have questions, raise your hand or type your question into the question box.
And also, I think we could open it up that if you have any general questions from anything I've said today, please feel free to ask that.
Clara, there's one question asking if you can recommend an article or 2 as examples of CRQ case study using a group.
There haven't been any done so far using groups.
Do you have any suggestions for articles to reference or single case study? That was actually an earlier question that we had.
Yeah, we published in Psychotherapy, Theory, Research, Practice, and Training 2 case studies in 2009. The Therapist Immediacy, Case Study 1 and Case Study 2. Actually, I guess that's 2008, I'm sorry. So those are 2 really good studies. Those are really the first ones we did using this method. And particularly I recommend Case Study 2 because we really kind of refined it by that point. So, yeah, the Case Study 2 is Hill et al., Psychotherapy, Theory, Research, Practice, and Training, 2008.
We have another question from Raquel.
Just a quick question. I would like to know the number of participants you would advise or suggest for the consensual qualitative research. If it's still 8 to 15, I believe that it was mentioned in your first article in 96. Or
Yeah, good question. You know, it really depends on the study. Generally, I like 13 to 15, but you know, I've published one with only 5 participants because it was a journal study where students kept a journal for a whole semester. I think and a large part depends on how homogeneous the group is. If you have a group that's kind of not very homogeneous, you'll get a lot more variability and you won't find typical results very often. So usually around 11 to 15, you start getting some stability of results. And so that's kind of what we like to see. But, you know, sometimes you can't, like in the study we did on dreams, we could only get 9 participants, and we were lucky to get that many. So sometimes you go with less, but you know, you kind of, it's nice to have 13 to 15 because you start getting more stable results. But you also, I think it's very important when we're talking about this, that you try to get a sample who, you know, you try to carefully select the sample to be as consistent as possible. So, for example, in our study on attitudes about help seeking, we chose undergraduates from 18 to 21 years of age who had never been in therapy. Okay, if we had chosen everybody and all their experiences, we might have had a lot of variability within the sample. And if you have a huge number of participants, you can end up dividing your sample. So you can, for example, you can talk about people who felt misunderstood or people who felt understood. Sorry. Go ahead.
I'm having that difficulty because I'm studying the experience of termination.
Okay.
So I'm collecting the data from the clients that actually terminate in the clinical practice in the university. So
Okay.
I don't get to pick very much, but that is actually happening because that you mentioned they are very different in ages, in sexes, the therapist's sex, the gender, the problems. So I'm a little bit confused because I get a lot of categories with only one person or two, one participant or two. So you're suggesting that I should narrow the participants or try to choose a little bit more instead of trying to get everything.
Well, what might be really interesting is if you look at your sample carefully, if you could have about 15, if you could look at your sample carefully and see if there's some way of dividing the sample into 2 subsamples. Because I think one of the most interesting things with CQR is to have 2 different samples, so you can.
I thought about that. I thought about dividing, depending on the results, dividing on the problem, or on the one thing that I think it would be very interesting is on the theoretical orientation, because the
Sure.
results are very different.
Yeah,
Uh,
that'd be great.
so
So,
I might
and
do that.
yeah, so that's an example of where it's better to have a larger sample, because then you can look at subgroups within. Because lots of times ahead of time you don't know quite how much diversity there's going to be within the group. But if you can,
Exactly.
right? So yeah, that's terrific if you can have enough people, so you can look at, did they terminate because they were angry, or did they terminate because they had solved everything? I mean, those are two very different groups, and you would expect termination to go very differently with them.
I also have already not included the dropouts. I'm only including the terminations with a successful outcome,
Yeah. Oh, good.
because it would be impossible to study everything.
Yeah.
I have
Right.
to make some choices.
Right. Yes, you have to. It's really important to spend a lot of time at the beginning figuring out exactly who you want to study.
That is the most challenging part.
Yes.
I think.
Yeah.
It's hard to give up on information. For example, I get a lot of information from the interviews about the process, and I'm not going to be able to use it right now in this particular study, and it's a shame, and it's hard to see so many important information about the process of change and not use it.
Right.
Because I'm a PhD student, so
Right.
I have to stick to the project. And
That's a really good point, because a lot of times with this kind of data you get so much.
so much.
You have to figure out, especially when you're writing it up, how to tell a good story.
Yes, that is the very hardest part.
Yes.
I'm still swimming in the data, I guess.
Yeah. Yeah. Very difficult. But sometimes you have to figure out what the best part of your data is, and you can always come back and look at the other stuff later, collect more data.
Yeah. Thank you.
Next we have Ruth.
Sure. Hi, Ruth.
All right, Ruth may not have an active mic, but I have a written question, so I can read that to you.
Okay.
She asks if we use CQR to analyze data from reflection papers. We cannot ask participants follow-up questions.
That's
Do you
right.
have any suggestions for that?
Yeah, I mean, that's obviously, we're talking now about CQRM. That's obviously a problem in CQRM because you can't do probes. So you really have to, when you're making up the questionnaire, you have to think carefully ahead of time about what you're asking and pilot, again, at a number of times to make sure people are answering the questions the way you want. So you're absolutely right. You can't ask probes. And so it's not, this is not as rich data as you get with interview data. So if you really want the really rich data, you need to do interviews. This is more to get more of a larger sample of an idea of more. For example, you could get a representative sample and get some ideas about what a lot of people thought about a particular topic. Whereas when you have the CQR interview data, you can try to be very careful about your selection, but you're rarely going to have a representative sample. Of course, we should mention that in most psychotherapy process research, we rarely have representative samples. But the rich data you're going to get from interviews, not from this modified approach.
Now we have a question from Kim.
Hello, Clara. This is Kim. I have a more general question. In the beginning, you told us a little bit about the interviews and about how you have to be a very empathic interviewer.
Right.
This sort of triggered for me. I'm doing a lot of interviews with structured interviews, and so mainly diagnostic. But I was always taught to sort of not be empathic. I mean, you have to be kind, but not really too empathic, not to draw the patient sort of into their problems, but to keep that fine line between being nice and a good listener, but not really too involved with the patient during the interview. Can you comment on that, or?
Well, you're right. It is a very fine line. You're not doing therapy, but you're also trying to get very rich, deep data, which is often stuff like you get in a good therapy session. And the only way you're going to do that is if you have a good rapport built up. And so I think this is the point at which I have to be very clear that this is not unbiased data. This is very much where you as an interviewer have a relationship with a client, and the more they have a relationship with you, the more they'll tell you. Now, we don't interpret. We don't put words in the participant's mouth. That's very important. We try to make sure they're saying what they want to say. But I think, you know, if you're too bland, I've seen this happen in so many interviews where the person's nice, but they don't probe enough or they don't develop enough of a rapport. They don't get the participant to really get into their feelings about things. And for the most part, I think when we're talking about therapy, you're talking about some pretty intimate, close kind of things that people are going to have a hard time talking about until you make them safe. I can clearly remember an interview with therapists when we did a study on compassion, and we were asking them about clients with whom they felt little compassion, and they weren't ready to trust until, you know, kind of the second interview, and then they felt, once they felt comfortable, they could talk about a lot of deep stuff, their own issues, their feelings about the client, but those are things they're not going to talk about until they trust you. So yes, it's a fine line between being empathic, trying to elicit as much information as you can, but not doing therapy, not interpreting, not telling them what to do about it, but trying to listen with the third ear. Does that make sense?
Okay. Yeah, thank you.
Sure.
I think we have one more question from Raquel.
I'm sorry, another question.
Thank you for asking.
I'm really interested. So you were talking about the interviews, and I have conducted a lot of interviews, and I really noticed that especially if you build a good rapport, people really open up. They talk a lot. And that leaves me with a question. You get all those domains because people sometimes go beyond our questions and talk about important things, but they are not. They are important things for the process, for the person, for their feelings, but not for our study in particular. So then we have all those domains that do not have much to do with, in my case, termination. So you were suggesting, I don't know if I have understood correctly, you were suggesting that we should not analyze that for the sake of time for this particular study and leave it to other studies, and is that right?
Yeah, I think again when you're writing up your paper you have to focus, because if you start talking about too many things you lose track. You're not telling a good story. So yes, I think when you do your write-up, if it's tangential to termination, you don't put it in there, but you you use it as rich data that you say, well, maybe I want to develop another interview protocol that gets at these other issues more completely. Or sometimes, though, you find information about termination that you hadn't even thought of asking. And so that enriches your data.
That has happened. I'm talking about all those things that, because we read everything, we code the domains, but there are things that are really tangential, as you mentioned. And I'm yes.
Yeah, I would go ahead and code all of that. I wouldn't make judgments about the data until the very end.
Okay. Okay.
I would wait to see exactly what we've got, because you don't know when you're doing individual cases
You're
what's
right.
going to be important later on.
You're right. Okay. Thank you very much.
Sure. I would always err on the side of coding too much.
Okay.
Any other questions? Yes, we have one more question from Myfen Y, I think is. I'm going to unmute now.
Hi, Mayfen.
Give me 1 second. I haven't unmuted yet. There we go.
Okay.
Okay.
You can ask your question now.
Oh yeah, I think that the first question I would like to ask is in the case study, there is only need one case or can be more than one case?
We've done it both ways. We've done single cases, and then we also have, in the new book that Louis and I are doing on corrective experiences, we have a chapter where we compare 3 cases with the same therapist who saw 3 different clients with anorexia. And we looked at the corrective experiences in that case, those 3 cases, and we're able to compare across cases. So in effect, you can do either one. You can do a single case, or you can do multiple cases.
Okay. Okay. But it's if multiple cases, and then that means need to be the same topic or the same.
Right.
Okay.
Right. You'd be looking at using exactly the same method across all 3 cases so that you can compare across cases.
Okay. Okay. Another question I have is let me see. Oh, any computer software will you recommend for coding the data?
No.
Okay.
We just do it the hard way of cutting and pasting.
Okay.
I'm sure.
Use Excel file or?
Yeah, we just do it in Word.
Oh, in Word.
And then we use a table function to put everything in the tables, and you can use Word will sort the data for you.
Oh, okay.
But yeah, we've never used any computer programs. I kind of really like to stay as close to the data as possible.
Okay.
So I mean, I'm sure there's computer programs out there. I've just never used one.
Okay. Thank you. I think it's very helpful.
Thank you, Mayfen.
Yeah. Oh, another question. I'm
Sure.
wondering, can we have your PowerPoint slide?
I think the whole presentation will be on the web, right, Louis?
Yes. The entire presentation will be available on the SPR website.
Okay, good, great.
And also, since we're on that, let me just tell you, for people who might want to know the resources available about this method. There's some references here. The first thing we wrote about it was in 1997, and then we did an update in 2005. I have a chapter in a book that's coming out, and also we have a new book coming out, the whole book on the method, Consensual Qualitative Research, that'll be coming out next summer. American Psychological Association is publishing it. And I did this book with chapters were written by all the people a lot of the people who have helped me work on CQR over the years. And I'm an author in every chapter too, so there's a lot of consistency across the chapters. But this will be a great resource for people wanting to do CQR.
I believe we have 2 more questions. One is from Yuko.
Hi, Dr. Hill. Thank you so much for the talk. It was really fascinating, and I'm pretty new to qualitative research, so I learned a lot from your talk. I'm curious to hear about your thoughts on establishing external validity. So how would you go about determining to what extent your findings are generalizable to clients or therapists at large versus determining to what extent your findings are specific to your cases or your samples?
It's always the good question about qualitative research, and it's always the most difficult one to answer. I think the best answer I can give you is you do individual CQR studies, and then what really is important is doing a number of studies across time, and then you compare studies across time. So I'm not going to have time to go through the qualitative meta-analysis, but it's a very exciting new development within Timulak, and a number of other people have talked about qualitative meta-analyses. In the book we have a good example of some qualitative meta-analyses. But basically then you go across studies and you find out how many studies give the same idea. So for example, in just quickly, we looked at, we asked participants, why did you participate? And across 10 studies we asked this question. The most frequent reason across 10 studies was it was at least variant in 90% of studies that people participated because they had a desire to help. Okay, now if I have 10 studies that say that, and that category is variant in at least 90% of the studies, I'm fairly confident that that's a robust generalizable finding, right?
Sure.
Second most common reason was the topic was interesting or important, and then later we can explore differences among groups, and in fact we find out that professionals have different reasons for participating than graduate students do. Okay, so that gives us a really good idea of how generalizable it is to a bigger population. But the only way you can really get to that is by looking at a number of studies.
Sounds good. Thank you so much. I look forward to reading your book. Thanks.
Sure. Take care.
You too.
We have a question from Thomas.
Tomas, I think you had your hand raised. If you don't have a mic,
Okay, can you hear me? Yeah.
Hi, I can hear you.
Thank you for introducing this CQR method for me because I'm new to it. I have a more general question because I'm interested in how does it compare to the grounded theory method? What do you see? What are the advantages of your method over grounded theory?
Good question. I mean, it's the most common other method used of qualitative research. I mentioned that what we do is first put things into domains, and then we do core ideas. In a way, grounded theory does it backwards. They do it first. They just look at all the data and they summarize it into more like core ideas, and then they try to put all the core ideas into a structure that they develop by sorting all these core ideas, and so they develop their category structure again backwards from ours. So that's one of the major differences, is kind of how you approach it. They also come up with one core idea that kind of describes the whole study, whereas we don't do one big core idea. Another major difference is grounded theory, often they use just one judge to do, the one person does all the interviews and analyzes all of the data. And so this idea of consensus is very different from grounded theory, that we're trying to get multiple perspectives on the data so that we don't just have the world according to one person. So those are probably the two biggest differences between grounded theory. I think in general CQR is a little bit more systematic in that we kind of give clear steps. When we first started doing the qualitative stuff, we looked at all the grounded theory stuff, and I just could never quite understand how they did it. So I was trying to modify it to make it a little bit more clear-cut so that other people could try to use it, and so there could be some consistency across different studies. So those are kind of the main differences.
Okay.
One is not necessarily better than the other, it's just they're different.
Sure. I'm interested in how does the CQR work with the process or with connecting the categories, which is the domain of grounded theory method. I mean, what follows after the categorization if you connect the categories or themes into a theory, or you finish at the level of categorization?
We don't really get into the theory so much as more description. So that would be another difference. I mean, that's what I meant by their core idea. They kind of say, they spend a lot of time talking about how the big core idea and how all the categories fit together and the properties of the different categories. we don't do that as much as really just describing a phenomena. So, you know, if we're talking about different things like compassion, we're more interested in talking about what does compassion look like within therapy rather than coming up with a theory about compassion.
Okay, thank you.
Sure.
Well, I'm sure that there's many more questions that people would like to ask, but I'm also looking at the time, and I also know that Sam will want to conduct a last poll. So probably this is and I just see now that the poll is actually being, is on board now. So perhaps I think this is the time to say thank you to everybody who's participating. We have way more than 30 participants from all over the world. I want to thank everybody. I also want to thank again Kim, Sam, and Sven for making this possible, and of course Clara, I want to thank you for such an exciting and comprehensive review of your work. This was really wonderful. There's many people in my office here who are, all of us were very excited by what you presented. I want to thank you for all of this time and energy. Great, thank you.
Well, thank you so much. It's been a lot of fun.
So maybe Sam, you want to close this up?
Yeah, I just want to say that you can expect emails from Sven, Kim, and me asking for new suggestions about other things that you might want to see in the future. So expect those emails. Think about what you might want to see in future webinars. And thanks a lot for your participation. And like I said earlier, this recording of this, including the slides, will be available on the SPR website within a week. It'll just take us a little while to get it uploaded.
Thanks, everybody. Thanks again, Clara.
Thank you.